Hey everyone, I'm Dr. Jason West, and in this podcast, we're going to be talking about lung conditions, how 2 little-known supplements help to rebuild the lungs and better oxygen transport, how a refined tree sap can help you improve lung function and improve oxygen carrying capacity. There's a way to reset the nerves and that really control your lungs, and in some cases, we can even improve hardened scar tissue. You know, some doctors say, no, it's not possible, and it probably is for them. But in this episode, you're going to discover the best kept secrets from the mass media and what doctors just aren't trained about in healthcare conditions, particularly with the lungs. And more importantly, if you are a loved one who has a lung conditions, I want to show you how to live your life with the least amount of prescriptions, steroids, nebulizer, oxygen concentrators. And so in a nutshell, I'm going to give you something that you can finally do to help rebuild your body, improve the cells, get your lungs working, and be the best you can be. It's the Dr. Jason West Clinic podcast. So excited you're here. Let's get it rolling.
Welcome to the West Clinic Hellness to Wellness podcast. This is taking people that are sick, out of hope, frustrated or confused with their medical recommendations, or are searching for another pathway to health, and it's finding incredible patient outcomes of people just like you. And it's not just saying it. You can see and hear the hundreds of patient success stories on our website, blog, YouTube channel, and of course, right here, coming at you with over a century of patient success in the West Clinic system. Here's your host, Dr. Jason West.
All right, you guys, here we go on getting just a fantastic program on lung conditions. And I have the little joke about, oxygen, it's only important when you don't have it. And certainly when it's a problem to get into the organs, tissues, and cells. And obviously that's done through the lung interface. But where this story even came from is I had a patient say, hey, Dr. West, what can you do for lung function? I'm not feeling very well. And I started outlining it. They went over and they told their lung specialist, hey, I'm doing so much better. And the lung specialist said, well, he's not qualified to help you with lungs. And the patient was like, no, you don't understand. He really, really helped me. And so I kind of chuckled about that. You know what my own story is? I've been in practice for 22 years inside of the trenches, really implementing stuff that my grandfather taught my dad and my dad taught me. We have over 106-year-old clinic. And so one of the times I was teasing my dad when I got into practice about, that FDA comment that says, statements have not been proven to be safe or scientific, et cetera. He said, you know what, Jason, just get out of my way when I'm helping people. And that's how I feel on lung conditions. Man, I've seen this happen for over 2 decades. The proof, this is one of our blogs. I have over 1,000 patient testimonials. So this is based upon my clinical experience of working with people inside of the trenches. And so my mission is really to help people to improve and live their life at the highest level. And that oxygen, that breathing process is so important. And so the gold in the podcast is this. Most healthcare providers think that lung conditions are all about controlling inflammation or giving you an antihistamine. And obviously, staying away from the offending agent if it's hay fever or it's triggered by cats or if it's triggered by environment and chemicals, you do your best to stay out of that area. But for the most part, that's where things stop. And there's so much more that you can do for healthcare conditions. And particularly, there's ways to help rebuild the lung tissue. Now, most providers aren't taught this, but there is a DNA tissue extract, a DNA blueprint that comes from specific tissue extract. Then my observation in clinical practice for 22 years is it really helps people. And what also most healthcare providers aren't thinking about is not only do the lungs have to be healthy, but the transport vehicle that takes oxygen from the lungs over to the organs and tissues, also known as the red blood cells. They have to be healthy as well. And so a lot of doctors aren't paying attention to the red blood cell membrane. And then also, like, this happens so many times in chronic disease conditions. We're going to talk about in this podcast a technique, a treatment. It's not a technique. It's a technique called neural therapy, but a treatment that was pioneered by a medical genius before his time down in Louisiana named Dr. Harold Philibert, that found this link between the nervous system, the muscles, and the lungs that helps to reset lung tissue. So if you've had a significant infection, if you've had pneumonia, bronchitis, if you have been having exercise-induced asthma, even asthma from when you're a little child moving forward, I've seen really good outcomes with this. Now, just like all treatments, it's not 100%. I don't want to mismanage or mislead people's expectations, but the outline that I'm going to walk you through is absolutely phenomenal for lung conditions. I mean, it's just so helpful, and it's not being taught, and it's not being utilized by the vast majority of healthcare providers. So I told you about lungs, right? We have oxygen coming in by what they call negative inspiration, like it has to basically be, it's being sucked in, and then hardly any of my lung patients that are coming in, their doctor never makes the connection between lung function and red blood cells. Also, we have to remember that the lungs are also a gland of detoxification. So this is so important to clean up the inside, because as you put stuff out through your lungs, this is one of my thoughts of why there's a lot of cancer that goes to the lungs, because the body's trying to get rid of it. Like if you want, and you want to know about a waste product for lungs, like you should go on, like a Boy Scout overnight or stay in a group inside of a camper or a tent. It stinks in the morning when everybody gets up, because everybody's outgassing all these chemicals and poisons that the body, when possible, converts to a gas. The liquid's going through the kidneys, the solids are going through the liver, and the lungs are really important for not only for oxygen coming in, but detox products that are going out. And so when we look about this, some of the best treatments that you don't know about are something that I get to share with you here. So here's how I've seen a lot of lung conditions going better. There's about 6 things. So the first thing is so much of the treatment and the diagnosis and the information comes from the patient workup. Like, you have to listen to people. You got to be able to remove triggers. Now, triggers can be an exposure. It can be an emotional event. It can be physical trauma. It can be scars. And we're going to talk more about this technique of how to reset scars and reset the lung field. We want to give the body a blueprint to follow, put building blocks in to help repair lung tissue controlled by the nervous system, and something that's really good for hardened lungs. So COPD and sarcoidosis and some of these other conditions, I've seen really good outcomes with that. So literally, here is how the pathway works, or what's important to review here. I'm just going to put this right up here on the screen and be like this. Okay, when possible, you remove the trigger. And again, sometimes that's physical, sometimes there can be emotional, sometimes it's stress related, which, by the way, stress is not a disease. It just makes every disease worse, right? So that's where we always talk about, you have an outlet on all of our podcasts: prayer, meditation, deep breathing, walking, talking to yourself, journaling, going on a drive, going to the gym, having sexual relations, having a hobby to do woodworking with your hands, or building models, or playing a musical instrument. I've seen good outcomes with getting things lined up from the nervous system for chiropractic adjustments. I see really good improvement with lung conditions with those. And then the infraspinatus respiratory reflex, which I thought I had all dialed in. Here it is, if I can pull it up right here. The infraspinatus respiratory reflex is something that was developed by Harold Philibert that I think it's so important to check out your lung fields. And when I say check out, like, it's a way to reset the nerves so that controls, and it's particularly the C4, C5 nerve root. And I just want to walk you through this presentation really quick because it just really helps with lung conditions to get everything jump-started. So Dr. Philibert developed it after noting nearly 100% of his patients with asthma improved. He went through and he looked at the muscle attachments for the nervous system, and he's taught this technique to hundreds of people, but it's how you help the automatic nervous system in respiratory health. It's the autopilot for everything that is occurring. And literally, if I get to where all the nerves come out, so this was a doctor presentation that I have streamlined, and I didn't think that it was so. Okay, here it is. All right, the treatment, have the patient lay on their stomach right here with their arms laying off the table. You palpate the infraspinatus muscle. Now, the nerve that comes out of the spinal cord that goes to the infraspinatus muscle, part of that goes to the lung field. The front part of it goes to the lung field. And he found that when he would work where these muscles and their attachment and this nerve structure that you can see right up here on the screen, that it would go and it would get the lungs to reset. And so when you start working on this muscle, so here's what the muscle looks like. You can reset it. Now, why this is important for lung conditions is frequently when the body's injured, it has a memory. So I'll work with rodeo or rancher guys, and they'll be out practicing roping. They'll rope a calf, and then they'll get their rope caught around the finger. Sometimes the cow will get scared and run off, and it pulls their finger off. Now, we call that, I mean, obviously it's a tragedy, but a lot of times people come in and they'll say, I hurt, and what's happening is we have injured the nerve, and it's telling the brain, I hurt, I hurt, I hurt, I hurt, I hurt. And so we call it phantom limb syndrome. Well, just because, you haven't necessarily had a lung amputation, but so many lung conditions get stuck in that injured tissue response, and coming and looking at this muscle and resetting it with some vitamin injection therapy. I like using B12 is what I like to do to reset this muscle. It tremendously helps the body to reset, or the nerves to reset. Now, that's one thing that we do. Here's some other things that are really important. There is a glandular therapy. A glandular therapy means that we get lung components from different animal tissues, primarily cattle, and there's a way to process that, and it gives basically the DNA extracts, or what they call the Protemorphogen therapy, and it helps guide the body into developing healthier tissues for the organ. So there's one for the liver, there's one for the kidneys, there's one for the lungs, there's one for the thyroid. But this blueprint model, in my experience, has really helped people to recover from and improve from chronic healthcare conditions related to the lungs. So chronic obstructive pulmonary disease, asthma, long haulers conditions, other types of infections, pneumonia, where it really, really damages the lungs. This is one way to give the body some building blocks to actually repair versus the anti-inflammatory, antihistamine therapy. Another nutritional component is to have a beef liver extract called vitamin E2. Now, there's all these vitamins that have big names like vitamin C, vitamin D, vitamin E, vitamin A, but there's also some, like a biochemistry component where there's cofactors that make those vitamins work. Are they really a vitamin, or they just make the vitamin work, like rutin factor or quercetin for vitamin C? My dad always used to refer things, old school terminology of vitamin P, vitamin G, vitamin T, vitamin F, were some of those cofactors that the early on nutritional functional medicine doctors called them different vitamins. Now it's kind of like a cofactor or an enzyme. But vitamin E2, what it does is it literally was discovered, and people that were looking about the Sherpas in Tibet, where they were taking people's packs and stuff like that, the native people, up to Mount Everest without any oxygen. The Europeans, the Americans, and the other people not from that area would really struggle, had to use supplemental oxygen. And they basically find this extract from cattle. The even better source of it, it's my understanding, comes from yaks, that helps to protect the phospholipid bilayer around the cells to carry oxygen. And so many people that have lung conditions, they're missing this component. And then something that's really good for hardened tissue is something called dimethyl sulfur oxide, or Dmso therapy. Now, there's a lot of people, especially in the animal world, that are aware of Dmso therapy because one of the mild side effects or problems with it is it makes you smell like cream corn or garlic. Like there's a very strong odor. And guess what? How the body gets this out of the system is through the lung field. And a shout out to one of my heroes, Dr. Taylor, taught me that you can use Dmso therapy as a universal softener, particularly for lung conditions. Now, it's basically refined tree sap. It's basically one of the byproducts of making paper. And there's an interesting story of where Dmso comes from, but it has such an important place in lung therapy. So when we're looking at the different conditions of how we can help lungs, number one is try to remove the trigger. Number two, we want to have healthy and alive foods going in your system. We want to have a stress management. Number three, getting some lung tissue extract to rebuild lungs, helping the red blood cells to carry oxygen better, resetting the nerve supply that comes out of the brain to the central nervous system down into the peripheral nerves, and the peripheral nerves go through the organs and the tissues to the lung fields, resetting that reflex, the Dr. Philbert treatment, the Infraspinatus respiratory reflex, using dimethyl sulfur oxide to help soften up the hardened tissue. So you can see there's a lot to go over for lung conditions. There's all these different disease categories inside of lungs. So here's a couple of ways that I can help you on your journey. If you have access to a Protemorphogen lung therapy and a beef leaflet extract, like you should be taking that. There's some other vitamins that I've seen that help with that. Primarily manganese is really important. It's a mineral that helps the connective tissue, the fiber and the ligaments and everything associated with the lung field. If you'd like more information, all you have to do is type in #lungs inside of the comment field. That's one way where we can pick it up and contact you, get you some more information. If you need to jump to the top of the line here, and what I mean by that, some people need help immediately. So let me get this so you can get this right now. You can just email us at info@westcliniconline.com, or you can call us at 232-3216. I can help you quicker or faster to get a additional information, but you don't even need to do that. If you just want to type in #lungs inside of the comment section. Now, I've helped people across the street and across the country. The purpose of the presentation is to give people some considerations and some hope that it's not just, hey, take 2 of this and call me in the morning. Just take this steroid or just take this antihistamine until you expire and you move on to the next phase. There's things that we can do that will build up the system, and this isn't a gamble. I've helped hundreds of people from across the street and across the country getting help, and I'm tired of some of the stories that I hear. So that's one of the reasons I wanted to do the podcast, is to tell people, look, there are other consideration for lung conditions. So again, if you'd like more information, just type in #lungs. If you receive value and consideration from this, please, either like or share the podcast or the comment section, because lungs, it's no joke. Like, if you can't breathe, it's hard to enjoy life. It's hard to have energy and vitality. It's hard to detox, start things. It's just bad all the way around. And I've seen some really, really good outcomes for lung conditions. So here's my final takeaway, or my final things that I'd really like to share with you here. Number one, there's more hope out there than most doctors are telling people with a conventional prescription approach, or telling people, oh, you have exercise-induced asthma, or you have breathing conditions or some other things, like you should be less active. Like, that's the opposite of what the goal set is to improve organ function, improve your oxygen. There are rebuilding tissue extracts that you can do that helps the lung to improve. There's ways to improve your red blood cell membrane with plant blood extracts with vitamin A, vitamin D, vitamin E, vitamin K. Those fat-soluble vitamins and essential fatty acids help to protect the phospholipid bilayer of your red blood cell membrane. With all chronic healthcare conditions, frequently there's a nerve associated with that we need to reset the nerve supply that goes to the lungs. And what we can do is a lot of times we can soften hardened, scarred lungs from significant infections and other things using a Dmso therapy. So that really is our overview of our podcast on lung conditions. There's other options out there. There's always hope. If you like the information, you can join us Wednesday, 6 o'clock. I always do a patient success story. You can pick up our podcast on iTunes and literally where any podcast platform, we're usually on there. I'm your host, Dr. Jason West. This is my podcast on lung conditions, and I will see you guys on the next
Thanks for
podcast.
listening to the Thrivers program. The purpose of life is to live, not just exist. Join us with the podcast or video library. We're on a mission to help as many people possible to know and understand their options. Here's to your energy, balance, and longevity.